Je passe la parole au ministre Duclos.
Bonjour tout le monde. Good morning or good afternoon, everyone. I am in the company this morning of my colleagues, Madame Diane Lebouthillier, qui est la ministre du Revenu national, Minister Carla Qualtrough, who is Minister of Employment, Workforce Development and Disability Inclusion. Also with us is Dr. Theresa Tam, who is Canada's Chief Public Health Officer, et le Dr. Howard Njoo, qui est l'administrateur en chef adjoint de la santé publique du Canada. Ce matin, le premier ministre Trudeau a fait des remarques importantes. Il a rappelé tout d'abord que les livraisons de vaccins avaient repris, que la semaine dernière, des livraisons importantes de Pfizer et de Moderna avaient été reçues et qu'elles sont présentement en voie d'être livrées aux provinces et aux territoires et qu'à partir de la semaine prochaine, on s'attend à ce que le nombre de vaccins reçus de Pfizer augmente considérablement. Il nous a aussi informé rapidement qu'à partir de lundi, le 15 février, donc dans quelques jours à peine, tout voyageur de la frontière américaine qui traverse au Canada, voyageur pour des raisons non essentielles, devra présenter un test diagnostic PCR à son entrée au pays. Et il a aussi mentionné l'importance d'utiliser les tests diagnostiques rapides que les provinces et les territoires ont reçus et que le secteur privé est en train de mettre aussi en place de façon à protéger encore davantage la santé des gens dans le contexte de la pandémie. So I would now turn to my colleague, Minister Qualtrough, for opening remarks.
Bonjour tout le monde. Hello everyone. Je suis très heureuse de me joindre à vous aujourd'hui avec mes collègues les ministres Lebouthillier et Duclos pour cette annonce importante. Depuis le premier jour de cette pandémie, nous avons mis en place des mesures historiques de soutien de revenus pour aider les Canadiens à traverser cette crise. The CERB helped millions of workers and their families pay for things like food and rent at a time when we were asking people to stay home and flatten the curve. For many Canadians, this meant difficult weeks and months where very little, if any, income was coming in. We made the CERB's eligibility criteria as broad and inclusive as possible so that workers who needed support could get it, especially for the self-employed where income takes different forms. As announced by the Prime Minister this morning, if you applied for the CERB based on your gross income of $5,000 instead of net pre-tax income, and you met all the other eligibility criteria, you will not have to return your CERB payments. This means that as long as someone's gross self-employment income was at least $5,000, they won't have to repay the CERB. Pour faire le point en français, si quelqu'un a appliqué pour la PCU sur la base de leur revenu brut de $5 000 au lieu de leur revenu net avant impôt, ils n'auront pas à rembourser leur paiement. Il faut aussi, bien entendu, avoir rempli tous les autres critères d'admissibilité. By taking these steps, we are giving certainty to self-employed individuals who applied in good faith for the CERB. As I've said before, we'll always have the backs of Canadians. Today, we're also announcing targeted interest relief for Canadians who are facing income tax debt for the 2020 tax year as a result of having received COVID-related benefits. This will give Canadians who file their 2020 income tax and benefit return more time and flexibility to repay amounts owing. It also means interest won't have to be paid on any outstanding income tax debt for the 2020 tax year until April 30th of 2022. To qualify for this relief, individuals must have had a total taxable income of $75,000 or less in 2020 and have received income support through any of the COVID-19 targeted income supports. Nous avons fait de grands efforts pour soutenir les travailleurs pendant cette pandémie et nous continuerons à le faire pour reconstruire en mieux. J'aimerais maintenant passer la parole à la ministre Lebouthillier.
Bonjour à tous. Moi aussi, je veux prendre le temps de saluer ma collègue, la ministre Qualtrough, qui est sur la côte ouest du Canada. Donc, la Gaspésie et les îles de la Madeleine de l'Est vous saluent. Puis aussi mon collègue, le ministre Duclos. Mesdames, Messieurs, bonjour. Notre gouvernement est sensible au fait que les Canadiens ressentent toujours les répercussions financières de la pandémie. et je peux vous assurer que nous sommes là pour vous aider en ces temps difficiles. Pour ce faire, notre gouvernement a instauré une mesure d'allègement des intérêts pour certains Canadiens qui auront une dette fiscale pour l'année d'imposition 2020. Ainsi, après avoir produit leur déclaration de revenus, les personnes admissibles n'auront pas à payer d'intérêt sur une dette impayée pour l'année d'imposition 2020 et ce, avant le 30 avril 2022. Pour être admissible à la mesure ciblée, une personne doit avoir gagné un revenu imposable total de 75 000 ou moins en 2020 et avoir reçu au moins une des prestations d'urgence suivantes. La prestation canadienne d'urgence, la prestation canadienne d'urgence pour les étudiants, la prestation canadienne de la relance économique, la prestation canadienne de la relance économique pour les proches aidants, la prestation canadienne de maladie pour la relance économique et la prestation des prestations d'assurance emploi ou des prestations d'urgence provinciales similaires. On prévoit que cette mesure offrira un allègement des intérêts à environ 4,5 millions de Canadiens touchés par la pandémie. De plus, les paramètres des ententes de paiement ont été modifiés afin de donner plus de temps et de latitude aux Canadiens pour payer leurs dettes en fonction de leur capacité de payer. De plus, je voudrais noter que l'Agence appliquera automatiquement les mesures d'allègement des intérêts pour les personnes qui répondent aux critères. Donc, grâce à l'instauration de cette mesure, les Canadiens peuvent continuer de respecter leurs obligations fiscales sans subir des répercussions financières supplémentaires. En tant que ministre du Revenu national, je suis fière de voir que l'Agence fait passer les gens d'abord et notre gouvernement reste déterminé à aider les Canadiens à faire face à cette pandémie. Je vous remercie à tous.
Merci, Madame Lebouthillier. Alors, j'inviterai le Dr. Tam à présenter ses remarques.
Bonjour à toutes et à tous. There have been 808,120 cases of COVID-19 in Canada, including 20,835 deaths and 40,175 active cases across the country. Over the past week, there were, on average, over 103,000 tests completed daily across Canada, of which 3.7% were positive for COVID-19. And national daily case counts have been declining for several weeks. Over the past week, there were an average of just over 3,500 new cases reported daily, which is less than half the early January peak of over 8,100 daily cases. This is gratifying progress, knowing the sacrifices we have all been making. And we are now seeing the additional benefits in the steady decline of severe illness outcomes that is relieving some of the pressure on the health system and workforce. Over the past 7 days, the average daily number of people with COVID-19 being treated in Canadian hospitals has declined by 15% to just under 3,300, including 728 in critical care, and fatal cases have dropped by 20% to 100 deaths being reported each day. While declining case counts, hospitalizations, and deaths are reassuring, we must continue to be cautious. Over the past week, the total number of new virus variants detections has more than doubled. 7 provinces are now reporting variants detections. And the first detection of the P1 variant that was first found in Brazil has been reported by Ontario. Although it is normal for variants to emerge as viruses continuously evolve, these are considered variants of concern because they're known to spread more easily. There is also a possibility of reduced protection of current vaccines. This is why we need to maintain the strictest vigilance in our public health measures and individual practices. This will help to prevent these variants from reaccelerating the epidemic and making it much more difficult to control. With now more than 355 B117 variants, 25 B1351 variants, and 1 P1 variant reported in Canada, together with evidence of community spread in at least 3 provinces, and links to outbreak activity in long-term care homes, and other congregate settings, including a workplace, the risk is very real. But for every dark cloud, there is a silver lining, and we have several advantage points to work from. First and foremost, we know what works to control this virus, whether new variant or old. And second, we have the benefit of foresight from other countries who have demonstrated the effectiveness of sustained and vigilant public health measures to control new variant spread. Our way forward is clear. Right now, our measures are working. This means doing everything that we've been doing, but giving it the best we can give at all times. This simple rule can help us limit the spread of more transmissible variants while vaccine programs get underway. Aim for the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible. Stopping the spread of COVID-19 is up to all of us. Thank you.
Bonjour à toutes et à tous. Il y a eu 808 120 cas de COVID-19 au Canada, dont 20 837 décès et 40 175 cas actifs dans tout le pays. Au cours de la dernière semaine, plus de 103 000 tests en moyenne ont été effectués quotidiennement partout au Canada, dont 3,7% se sont avérés positifs à la COVID-19. Le nombre quotidien de nouveaux cas à l'échelle nationale diminue depuis plusieurs semaines. Au cours de la dernière semaine, un peu plus de 3 500 nouveaux cas en moyenne ont été signalés quotidiennement, ce qui représente moins de la moitié du nombre de cas quotidiens signalés au début de janvier, nombre qui atteignait alors un sommet de plus de 8 100. Il s'agit de progrès remarquables, sachant les sacrifices que nous avons tous faits. De plus, nous voyons maintenant d'autres bienfaits dans la baisse constante des cas graves de la maladie, ce qui réduit en partie la pression exercée sur le système de santé et son personnel. Au cours des 7 derniers jours, un peu moins de 3 300 personnes atteintes de la COVID-19 en moyenne ont été traitées quotidiennement dans des hôpitaux canadiens, dont 728 étaient aux soins intensifs, ce qui représente une diminution de 15% et 100 décès ont été signalés chaque jour, soit une baisse de 20%. Bien que la baisse du nombre de cas d'hospitalisation et de décès puisse être rassurante, nous devons continuer de faire attention. Au cours de la dernière semaine, le nombre total de cas signalés des nouveaux variants du virus a plus que doublé. 7 provinces font état de la présence des variants et l'Ontario est déclaré avoir détecté pour la première fois le variant P1, lequel a été décelé à l'origine au Brésil. Les virus continuent d'évoluer. Il est normal que des variants surgissent. Cependant, ces derniers sont considérés comme des variants préoccupants car on sait qu'ils se propagent plus facilement. Il est également possible que les vaccins actuels offrent une protection moindre. C'est pourquoi nous devons rester totalement vigilants dans l'application de nos mesures de santé publique et de nos pratiques individuelles. Cela empêchera que ces variants se propagent au point de provoquer une recrudescence de l'épidémie, la rendant beaucoup plus difficile à contrôler. Compte tenu du nombre actuel de cas signalés de nouveaux variants au Canada, soit plus de 355 pour le variant B117, 25 pour le variant B1351 et 1 pour le variant P1, et de la preuve voulant qu'il y ait propagation dans la communauté dans au moins 3 provinces et des liens avec des éclosions dans des établissements de soins de longue durée et d'autres lieux d'habitation collective, y compris au milieu de travail, le risque est très réel. Mais il faut voir le bon côté des choses, car nous pouvons tirer profit de plusieurs points positifs. D'abord et avant tout, nous savons ce qui fonctionne pour contrôler ce virus, qu'il s'agisse des nouveaux variants ou de l'ancien virus. Ensuite, nous avons l'avantage de la prospective par rapport à d'autres pays, lesquels ont démontré l'efficacité d'une vigilance soutenue concernant les mesures de santé publique afin de contrôler la propagation des nouveaux variants. La marche à suivre est claire. En ce moment, nos mesures fonctionnent. Il nous faut donc continuer de faire tout ce que nous faisons et d'agir le mieux possible en tout temps. Cette règle simple peut nous aider à limiter la propagation des variants plus contagieux alors que nous poursuivons les programmes de vaccination. Visez à avoir le moins d'interactions possible avec le moins de personnes possible, le moins longtemps possible, à la distance la plus grande possible. C'est à nous tous de freiner la propagation de la COVID-19. Merci.
Thank you, Dr. Njoo. We would now be pleased to answer any question.
Merci. Thank you. We will now move to questions on the phone for one question, one follow-up each. Nous allons procéder aux questions au téléphone pour une question de suivi chacun. Opérateur, première question. Operator, first question.
Thank you. Merci. The first question is from, la première question est de Bill Curry de Globe and Mail. Please go ahead. À vous la parole.
Thanks for Minister Qualtrough regarding this CERB gross versus net announcement. I guess three very precise questions. Roughly how many people are affected by this situation? What's the fiscal cost of making this decision? And then lastly, what do you say to those people who didn't apply for CERB because they went with the net income definition and now they realize that they'd gone with the gross, they could have received thousands of dollars last year?
Well, thank you for those questions. Very specifically, this response today addresses a specific issue of unclear information that was provided by our government that Canadians then relied on, in particular, self-employed Canadians. We will have a better clarity on the number of people who are impacted by this when people file their taxes. We have a sense of a possible range, but it's really difficult right now because so many people haven't filed their 2019 or 2020 taxes, and their eligibility and their gross income will be calculated based on that information. So it's a bit premature for me to say how many people, but we know that as a bigger number, we sent out 440,000 letters to people whose eligibility still needs to be confirmed. A subset of that amount are in this particular circumstance. In terms of the cost, again, it will depend on the number. And what I would say to people who didn't apply for the CERB is, I appreciate the frustration you may feel with this, but we are dealing here with a subset of the 9 million Canadians who applied for CERB who legitimately and honestly relied on misinformation we provided. And that's the problem we're solving here today.
As a follow-up?
No, I appreciate the three answers. That's great. Thanks.
Okay, thank you. Opérateur, prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Hélène Buzetti de Le Devoir. Please go ahead. À vous la parole.
Moi, je vais bâtir sur la question de mon précédent collègue sur cette question d'équité. Je comprends qu'il y a eu des informations, Mme Qualtrough, qui étaient peut-être pas claires, mais il y a plein de gens qui ont dit qu'eux, ils avaient compris correctement les règles et qu'ils n'ont pas appliqué. Pourquoi alors ne pas permettre à ces gens-là rétroactivement de faire une demande, par exemple?
Merci pour la question. Je dirais que nous pensons que nous avons trouvé une solution qui est équitable et raisonnable dans les circonstances pour les personnes qui ont été affectées par le manque de clarité dans l'information que nous avons donnée aux Canadiens. Franchement, on ne peut pas ouvrir la législation. On a décidé de ne pas appliquer cette décision rétroactive à tous les Canadiens. La solution aujourd'hui, c'est pour cette groupe de Canadiens qui ont vraiment relié sur l'information que nous avons donnée.
Et en sous-question, je ne sais pas s'il y a un ministre qui est en mesure de répondre, mais concernant ces mesures à la frontière terrestre qui nous ont été annoncées, on nous a dit qu'il pourrait y avoir une pénalité, mais on nous a parlé aussi de suivi. Est-ce que quelqu'un est en mesure d'être un peu plus précis sur ce qui serait attendu pour un Canadien qui reviendrait sans avoir ce résultat de test à son entrée au Canada? Merci.
Oui et non, Madame Buzetti, je n'ai pas toutes les informations que vous souhaitez obtenir. Ceci étant dit, ce que vous savez est important. Donc, les gens, on s'attend à ce que la grande majorité des gens arrivent à la frontière avec un test, frontière terrestre avec un test PCR diagnostique, puisque on annonce déjà à l'avance, 6 jours à l'avance, que ça va être le cas à partir du lundi 15 février. S'il y a des gens qui arrivent à la frontière sans test, comme le premier ministre le dit ce matin, il va y avoir une amende qui va être donnée par les agents de la sécurité frontalière. Et donc, c'est notre collègue, le ministre Blair, qui pourra vous fournir des informations plus précises là-dessus. Et pour le suivi de ces procédures, ben, ça relève évidemment du mandat des autorités policières. Alors, à nouveau, vous allez vouloir obtenir ces informations de notre collègue, le ministre Blair.
Merci. Thank you. Prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Mia Robson de Canadian Press. Please go ahead. À vous la parole.
Hi, Dr. Tam, I'm wondering if you could talk a little bit more about the variants. You said that we know what to do to stop them. So that sounds to me like the existing measures we have in place should be enough to keep those variants from spreading. And we've seen some positive progress in the last few weeks, but we're also looking at provinces that are now lifting those restrictions that have maybe helped that progress along. Wondering if you're concerned about if lifting any of those restrictions, the lockdown measures, loosening those rules are going to have an impact on whether or not we continue this progress because of the variants or maybe even in spite of them.
Thank you for the question. And I think absolutely we've made good progress, as we just went through in my remarks. But any loosening of these measures has to be done extremely cautiously because, as we all know, the population immunity level is not high. We're just beginning our vaccine programs. We've done many weeks of work in bringing down this epidemic curve, and the hospitalizations and deaths are beginning to come down. This is not the moment to really to sort of release everything that we've in terms of public health measures. I think province territories, of course, are making their individual decisions based on their own context, but all must do it with extreme cautiousness. And I believe some of them have plans to reapply public health measures very quickly, and if they see any changes. I think what my concern is that right now, if we release some of these measures, that a resurgence will occur, but that resurgence could be due to one of these variants, and then it will be much more difficult to control. So first of all, increase our testing and identification and sequencing and screening for these mutations is being escalated, but we need to do even better, I think, than what we're doing now. Provinces are screening more. Some provinces are aiming to screen every positive test for the variants, and that would be a good goal to aim for, increasing testing in the community. So it's, again, a balance of you can only ease things when you got the proper measures in place to rapidly detect and be able to implement public health measures again if needed. But I think, it is a concern. So when we said, right now, the simplest rule of thumb is still, restrict non-essential activities as much as possible. So aiming for that fewest interaction with the fewest number of people for the shortest time at the greatest distance possible is a very simplified way of looking at how we want to manage until the vaccine programs are well underway and that we learn more about these variants. But have you seen in Europe, if you look at England, Ireland, France, other countries, public health measures do work. So I think that is our sort of primary message. But yeah, do so with caution. If anything is going to be relaxed, then the proper measure for monitoring and response has to be in place.
Thank you for that. My follow-up question, I think, maybe is for Minister Qualtrough. there are more people in the group who got those letters, the 440,000 letters, than are being referred to today in sort of getting a reprieve from having to pay it back. Are you considering further amnesty for any of those people? And if so, what?
Well, thank you for the question. Just to be clear, the letters were sent out proactively by CRA to people for whom they couldn't confirm eligibility. Many of these 440,000 people have now filed their taxes, have been deemed eligible, aren't in that list anymore. So it's not. Let's not assume that all 440,000 will be ineligible, because we just can't. We just didn't have enough information. CRA didn't have enough information at the time to determine eligibility. And many Canadians have since filed their 2019 taxes, their 2020 taxes, and we've determined that they were eligible. If there's a specific subset of that you wish me to respond to, I can. But ineligible or eligible, we're going to work with Canadians to make this as seamless as possible for them. There's no requirement for people to repay now if they're deemed ineligible. We've announced today no interest on any tax you may have incurred as a result of being eligible for CERB. We're really trying hard to work with Canadians, relieve them of any stress or anxiety associated with our having helped them through the pandemic.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Christian Noël de Radio-Canada. Please go ahead. À vous la parole.
Bonjour, messieurs, dames. Merci de prendre notre appel et nos questions. Une question sur les tests pour les gens qui doivent revenir au pays et qui doivent avoir un test négatif pour montrer qu'ils qu'ils n'ont pas la COVID. Si certaines personnes ont déjà eu la COVID et donc sont maintenant ont été rétablis, mais ils ont encore un test qui démontre qu'ils sont encore positifs, même s'ils ont été rétablis, comment est-ce qu'on trouve une façon de les exempter de la quarantaine ou de trouver une façon de les traiter différemment puisqu'ils ne sont peut-être pas nécessairement contagieux, même s'ils ont encore la COVID en eux?
Merci, M. Noël. C'est une excellente question, Christian, et que je vais inviter mes collègues, les docteurs Njoo et Tam, à répondre parce que vous faites un très bon parallèle avec l'exercice semblable qui est en place depuis déjà quelques semaines aux aéroports.
OK, merci. C'est Dr. Njoo. Peut-être je peux commencer. Dr. Tam peut aussi ajouter. C'est une très bonne question. Oui, l'exigence maintenant, c'est pour tous les voyageurs qui arrivent au Canada d'avoir un résultat d'un dépistage moléculaire, un test moléculaire négatif avant leur arrivée. Mais c'est sûr que, comme vous avez constaté, qu'il y a peut-être des personnes aussi déjà atteintes avec le COVID-19 qui maintenant sont rétablies. Alors, on sait avec la science et aussi les données probantes qui continuent à évoluer que normalement, on voit que les personnes qui maintenant sont en bonne forme, qui ont déjà eu la COVID-19, après, c'est ça, 10 jours après l'apparition de leurs symptômes, on les considère comme des rétablis et plus contagieux. Donc, on continue à travailler pour peut-être avoir une façon de peut-être avoir, comme on dit, un autre certificat pour montrer si quelqu'un a eu la COVID-19 au passé, mais ça fait plus de peut-être 10 jours avant leur arrivée au Canada. Ça, c'est aussi, c'est peut-être pareil à aussi une test moléculaire négatif avant leur arrivée. Je ne sais pas, Dr. Tam, est-ce que vous avez quelque chose d'autre à ajouter?
C'est vrai, on va considérer les personnes qui sont déjà établies de COVID-19 aussi. On peut permettre les gens comme ça qui démontrent un test pour le COVID après 10 jours après le symptôme disparu, moins de 90 jours après la maladie. So it's really, we will take that into account of people who've had COVID-19, who can demonstrate that they have passed the period of communicability, 10 days after they've got better. But because we do not know the duration of immunity at the moment. I think what we're thinking right now is 90 days since you've had the illness. You can still count that period, and that will be considered in lieu of a test, that pre-departure test.
Oui, c'est pour ajouter en français pour Dr. Tam. Oui, on voit que les personnes peut-être 10 jours après l'apparition des symptômes, on peut les considérer comme peut-être rétablis et pas contagieux, mais aussi on parle aussi de l'autre limite, 90 jours, parce que on ne sait pas, peut-être personne qui a déjà eu la COVID-19 après peut-être 90 jours, c'est possible de peut-être être réinfecté avec la COVID-19. Donc, c'est tous les autres facteurs il faut considérer, comme j'avais aussi constaté, la science, les données probantes continuent à évoluer et on les considère toujours actuellement. Merci.
Merci beaucoup. Ma prochaine question concerne l'amnistie pour ceux qui ont fait l'erreur de bonne foi avec les revenus bruts et les revenus nets. Ma question est la suivante. Si il y a cette amnistie qui existe pour les gens qui auront fait l'erreur de bonne foi, on doit avoir une bonne idée. Madame Qualtrough, vous disiez que vous aviez une idée, en gros, du coût que ça pourrait apporter. Sans avoir d'idée précise, vous avez probablement un coût maximal et un coût minimal. Combien est-ce que le gouvernement évalue que ça pourrait lui coûter en dollars d'impôts qui ne seront pas payés?
Merci pour la question. Comme j'ai dit, on n'a pas un numéro exact de personnes qui va bénéficier de cette décision aujourd'hui. Ça dépend vraiment de l'argent dans leur tax filing, je ne sais pas le mot en français, quand ils font leur tax filing. Alors, c'est difficile à cette fois de déterminer combien de personnes. Alors, c'est un peu prématuré pour donner un numéro d'argent que ça coûterait. Ça dépend vraiment sur les autres facteurs comme l'éligibilité, non seulement pour le brut versus net, mais aussi pour les autres facteurs. Si on n'est pas éligible pour d'autres raisons, on ne reçoit pas les bénéfices, alors les prestations, excuse-moi. Alors, c'est vraiment, moi, je ne suis pas confortable de vous donner un numéro sans l'information exacte de numéro de personnes.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Karina Roman from CBC News. Please go ahead. À vous la parole.
Hi, yes, thank you. My first question is for Minister Qualtrough. You were quite clear repeatedly that the government was not considering giving this kind of amnesty to the CERB recipients who did it in error, saying there was no conversation happening about that. Can you give us a sense about why this about face? What's the impetus for the reversal of that?
Well, thank you. You're absolutely correct. In December, I said we've made no policy decision to permit people who had applied based on their gross income at the time. We've dug in. We've heard from many Canadians who find themselves in difficult positions because of this honest understanding of their eligibility. We've took the time to come up with a solution that balances all of the complexities that you've been asking about today in terms of fairness and reasonableness. And we reached a conclusion that the fairest and most reasonable way to move forward on this would be to allow people who applied using gross to not have to repay their benefits.
Okay, thank you. My other question is for probably Dr. Tam. As cases of the COVID-19 variants, as they become more numerous in Canada, as they're rising in Canada, should we be testing all positive cases for those variants? And since we're not doing that currently, are we right now underestimating the prevalence of these more contagious mutations of the virus?
Yeah, so Canada is, compared to other countries, is testing a higher proportion of our lab positives right now for the variants. However, we can sort of accelerate that. There are two aspects to how we increase our capacity to detect the variants. One is what we call a screening test for the actual mutations, like the N501Y of interest. That does not require whole genome sequencing because that takes a while. So that kind of screening for mutations that are of interest is being undertaken in provinces right now. And as the numbers of cases come down in a number of provinces, they are aiming to screen all of their laboratory specimens for those mutations. So that capacity development is underway. And the whole genome sequencing, which can be done on a subset of these, that capacity is also being sort of accelerated. For example, the Public Health Agency's National Microbiology Lab, in conjunction with the Cancogen genomics sequencing initiative in partnership with Genome Canada. So then you can also look at the whole genome on a subset of these. So I think we are accelerating right now, which is why I've been sort of saying that people need to be very cautious. These testing capacities are just accelerating. As you said, we might not know the full extent of the where these variants are in Canada at the moment. Provinces have done a huge amount of work when they find a variant case to be very diligent in contact tracing and looking at searching for cases and sequencing any cases around those. So that's another way of looking to see if these variants have spread. So I don't know if that answers your question, but it's true that we may not be detecting all of them for sure. And I think we may assume, for example, for the B117 variant, that there is a certain degree of community spread. The other variants, we're detecting less of them, but some of them, for example, some of the South African variant cases or the B1351 variant cases were not linked to travel. So that tells us that there's a degree of community spread, but that doesn't seem to be wide at the moment, but it's something that we need to be very cautious about.
It's Dr. Njoo. Maybe I can just add a couple points to what Dr. Tam said. I think we have to look at the opportunity cost and be sort of effective and efficient. It's not strictly what I would call a laboratory exercise, testing every single sample. We can always do that, but then you might, sort of be looking for, maybe sort of not in the most economical and effective, efficient manner. So as Dr. Tam mentioned, it's, doing it maybe on a sampling basis in terms of samples that come into the laboratories in the provinces, territories. It's also focusing with the public health and the epidemiological side. If there are certain events, cases like a super spreader event, then certainly that would, I think, point provincial officials to do maybe a more targeted testing of the samples involved with that maybe outbreak. For certain, especially if there are cases associated with incoming travelers to Canada, that would be another priority to look at in terms of doing the sequencing, looking for the variants. And then, of course, we're now looking in terms of potential impacts in terms of vaccines. So any of the cases that might be associated with individuals having received a vaccine dose, I think would be something else we'd be looking at in terms of seeing if there are variants around, if there's any impact in terms of the vaccine effectiveness. Thanks.
Thank you. Merci. We will take two final questions. Nous allons prendre deux dernières questions. Opérateur, prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Abigail Bimam de Global News. Please go ahead. À vous la parole.
Thanks for taking my question. I'm looking at the issue of so-called vaccine chasers, people looking for leftover vaccines at the end of the day. I'm wondering if nationally we're tracking what percentage of vaccines is usually left over at the end of the day, and if there are guidelines specifically for who those vaccines left over daily should go to.
So it's Theresa Tam. I could take a first try at answering your question. So I think with the actual implementation of vaccine programs is up to the provincial and local authorities. And of course, I think that if there are any leftovers, nobody wants to waste them. So any way in which people can get them into people's arms is really critical. And I think it depends on the setup and the situation where that clinic is. So I think that has to be looked at. I don't think we do not track every single bit of leftover vaccine or where they go to. That would be up to the local authorities. What we do try and share as best practices and making sure that provinces can share how they reduce any kind of wastage. And as far as I have been informed, provinces have done very well in terms of not wasting, any of the doses. So, yeah, and I think of course, as best as possible, go to the groups already identified as priority groups at higher risk of illness, serious illness, or at risk of transmitting those with highest risk of illness as well.
Yeah, it's Dr. Njoo. I just add that there was, as you know, a technical media briefing, and Health Canada has now officially approved in terms of the product monograph that at least for the Pfizer vaccine, they're now officially 6 doses in a vial as opposed to 5 doses. So I think the real live issue right now is to ensure with our provinces and territories, our partners, that you can reliably and consistently get the 6 doses out of the vial, and the information that the Pfizer has submitted to Health Canada is confident that with good technique and also with the right kind of syringes, what we call the low dead volume syringes, that you can reliably and consistently get the 6 doses out of a vial. And so we're supporting the provinces and territories with webinars to make sure that we reinforce what the good techniques are in terms of vaccinators drawing the doses out of the vial. And of course, one of the terms and conditions also put on the Pfizer company is to work in terms of continuing education, working with our procurement folks to make sure also that that they're supported, and that also that we can get the low dead volume syringes, make sure that the vaccinators in the provinces and territories have them to use for their vaccination with the Pfizer vaccine. Thank you.
Dr. Tam, I heard you talk about how your role involves providing best practices or sharing best practices with the provinces. I'm wondering if, as the vaccine rollout increases or as the number of doses increases, are there best practices being suggested to the provinces for any leftover doses at the end of the day, and where non-priority staff in some of these settings would fall in that case?
Yeah, so as everyone probably knows, there is a National Operations Center for the implementation of vaccine programs under Major General Danny Fortin. We also have public health networks, which includes the Canadian Immunization Committee, that is the federal, provincial, territorial construct, and they are sharing these kind of informations all the time. And so they are constantly sharing best practices. And as we move from, right now we don't have that many doses of vaccine to be administered. The best practices are also moving on to a point where we have many more doses available, and then how are those clinics carried out and how to minimize any kind of wastage is also being discussed as well. So those are the kind of governance tables that help share best practices. We also communicate with healthcare professionals organizations, and as Dr. Njoo said, some of these training programs to make sure that they're not, minimizing any sort of wastage. But there are other strategies too. I think that we learn from other countries where the simpler the set of instructions are in rolling out these programs, such as age-based, starting with the seniors and telling the population that, right now is this age group, is a much easier message to communicate, and then more people can show up at the end of the day as well if there's enough vaccines in a particular location. So I think all of these techniques will be utilized.
Merci. Thank you. Last question. Dernière question.
Thank you. Merci. The last question is from, la dernière question est de Rachel Haynes from CTV News. À vous la parole. Please go ahead.
Hi, thank you. My first question is for Minister Qualtrough, just as a follow-up to what a number of my colleagues have been asking as well about these CERB repayments. And just as a follow-up to Karina, when she was talking about how you had said in December that you wouldn't be, or you would not be forgiving this for people who had taken this on their net income. But have there been people who have repaid that money already based off of the letter that had been sent? And at what point is the CRA going to repay them back for this?
Really important question. Thank you. Yes, absolutely. If Canadians, based on getting the letter, took the initiative and made their repayments because they considered that they were no longer eligible because they had used their gross income, we will absolutely be repaying those payments to Canadians as soon as possible. So again, it's a case-by-case basis. We have to make sure they meet all the other eligibility criteria. But if they do, we will be repaying their repayments, which sounds a bit odd, but that's exactly what effectively will be done as soon as we possibly can. For those Canadians who took the initiative to try and make their tax slips as accurate as possible, we will work with them. We will be reaching out to them, or they can reach out to us and help them settle and balance their accounts.
Thank you. And my next question goes to Dr. Tam, just about this conversation that we've been having about the variants. And you had said in response to one of my colleagues' questions that if public health measures are lifted too quickly, that there could be a resurgence due to the presence of variants. And I'm just wondering if you can tell us a little bit more about what impact you see variants having on transmission going forward. Do you think we're going to get to a point where the majority of cases that we see are from these variants?
Yeah, so right now we are detecting particularly the B117 variant, as we just reported. And 80 countries in the world have this variant, including our neighbors in the United States. And the variants detected in many areas of Ontario, but also other provinces. This particular variant, I think, has definitely a chance to be the one that's replacing other variants. It's demonstrated an increased ability to transmit. So I think more and more evidence shows that this variant transmits more readily. How much more transmissible? I've seen different estimates from different countries, different locations, but the latest estimate is about 35 to 45% more transmissible. So as you can imagine, it's actually quite difficult already to slow down transmission with previously circulating viruses. And you add a virus then that is more transmissible, that just makes it much more difficult to get under control. So I think if public health measures are cautiously relaxed, the moment you see increase in cases and a variant is detected, those public health measures have to be rapidly reinstated depending on the findings. So I think one is that it's just going to be more difficult to control once the acceleration occurs. So you got to stop these, put on the brakes early if that is the case. The other, of course, is that we do not know the impact of vaccines on transmission at the moment. I do believe we will get some of that information. So we don't know anything about herd immunity at this point, but a variant that's more transmissible, even if the vaccines have impact on herd immunity, it may mean that more proportion of the population have to be vaccinated in order for that to be achieved. So it does have many implications, which is why right now we have to be very cautious. And as local and provincial jurisdictions begin to look at the data within their jurisdiction and cautiously open up, that has to be done very thoughtfully, very slowly, and to see what the impacts are. Does that answer your question?
I think that will be a yes. So thank you everyone for joining us today. Merci à tous de nous avoir rejoints aujourd'hui. Ceci met fin à la conférence de presse. This puts an end to today's press conference. Thank you.